Pope Francis is awake and alert and joking with his doctors after undergoing intestinal surgery earlier today. The Vatican says doctors repaired a hernia that developed following colon surgery in 2021. The 86-year-old pontiff is expected to make a full recovery, but he will remain in the hospital for several days as a precaution. The abdominal surgery comes before the Holy Father's rigorous travel schedule planned for this summer. Joining us now to help break down what this all means for Pope Francis is Dr. Roch Tiballi, infectious disease specialist with the St. Roch Center in Chicago. Hi, Dr. Tiballi.
So nice to be with you today.
First off, how common is it to get a hernia 2 years after intestinal surgery?
Well, it depends what type of hernia. There's something called an internal hernia, which can form after you develop scar tissue or banding inside the abdomen from the effects of surgery. That does not happen to everyone. It's a fairly uncommon event. My understanding is that the Pope is suffering from something called an incisional hernia, which is where the incision was placed. Some other bowel elements may have herniated through the anterior abdominal wall, so that almost he gets a pouch or a pocket under his skin that is other bowel that has come through the abdominal wall.
Yeah, on Tuesday, Pope Francis just got a checkup. Today, he's in the hospital for open abdominal surgery. So it seems this operation was necessary, right?
It seems so. If the doctor thinks that the bowel could be strangulated or cut off from circulation by getting caught in a very tight web, then they will take the person to surgery right away. It sounds like this is what happened with the Pope.
There's always a risk when you're put under general anesthesia, but the Pope is 86 years old. What does it mean for someone his age?
Well, they would have to keep a close eye on him while he's under the anesthesia to make sure he doesn't have any cardiac events. That time has come and passed. Sometimes for older folks, it's their body doesn't break down the chemicals used for anesthesia as fast as for a younger person. And so they watch him closely to make sure that he didn't aspirate or have difficulty swallowing after the surgery when he gets his first foods or fluids, and to make sure that his respiratory status is good after the surgery.
And of course, our prayers are going out for a speedy recovery for the Pope. Dr. Roch Tiballi, infectious disease specialist with the St. Roch Center in Chicago. Thanks so much for being here.
Okay, take care.